100%. I think just getting, because we got to go to the clinics, get to see the different levels of clinics there were, and the way that they do healthcare here. Experienced it firsthand myself. So, even from a preclinical aspect, it was definitely good in that aspect. We also got to see like the global health side of it, and I think even having that background, um, anywhere you go, because health is everywhere. So having that background of global health in a place like this is good to have.
Being able to physically see the difference it's making in people's lives, seeing how much they've learned, how much it can help them, like prevention methods. Now they learned new ways to help prevent them from getting malaria. And a lot of people didn't really know about the different plants because some of the things it's really hard to have access to, like bug spray and even insecticide nets. But plants is a really great way, and being able to teach them about it and then give them one of the plants at the end was really nice. And then just the first lesson I feel like was one of the most impactful ones for me. Because I feel like that's where I saw the biggest difference, because a lot of people, like I said, didn't really know how malaria spread, what exactly it is, what causes it, and that's what lesson one mostly focused on. So really seeing how much they did learn from that and being able to tell them how it properly spreads, how they can really prevent it, it was really, really nice to see. And I really liked it, and it's made me want to be able to do something more like that.
Absolutely do it. Don't hesitate in signing up. I think that medicine as a clinician is so much more broad than we think, because public health actually has so much to do with what we want to do in medicine as clinicians, because there are parts that a lot of people don't consider, and that's prevention. And that's something that I definitely stand for, because as a future physician, I want to ensure that the things that my patients are doing can be preventable. And I think that a lot of people do neglect that, especially if they don't have a public health background. I think it's something that really sets you apart from other applicants. So I think that having that public health background is so beneficial. And because this was centered around health education, gives you way more of an advantage than we would think. So if you are a preclinical student, you should definitely come on this trip.
So what I learned about myself was I always learned how to be like patient-centered in class, but I really didn't understand what that was. But to be able to like actually live the life that my patient lived, eat the food that they ate, interview them and talking to them, it's opened my mind a lot to patient care and patient-centered that I would never learn in the classroom. I enjoyed all the implementation lessons, the afternoon lessons working with people. I think the third lesson implementation was the most touching to me, just because everyone was into it, even the audience and the group members. Everyone was just very like cooperative. Everyone enjoyed the whole experience. So I would say personally, it touched me how everyone was impacted by it, but professionally, it made me want to look into other ways to get people involved in that way.
I think it's a great experience to learn about other people, like who don't have as many resources as we do. So you see some of the barriers they may face that you may interact with, like in the office or something like that. If someone were to come from, like, say, Africa or like Uganda specifically, you can understand kind of where they're coming from and kind of help them in a way that suits them.